So, Dr. Lurie, your office is charged with leading the nation in public health and emergency preparedness, response, and recovery. Before we delve into your priorities, what is national health security, and how do we get there as a country?
Well, what I would say is that disasters take many forms, and they affect all of us. We like to think that national health security is achieved when our country and all of our communities together are prepared to respond and recover from the health impacts of emergencies. To do this, you need strong, modern, nimble health and emergency response systems. You also need to have resilient people. And so that means, ideally, that you have people who are healthy. Prevention becomes very important. You can't have people who are worried about their health every day or health insecure. So on the one hand, we focus and very much support the prevention and health promotion missions of our department to help our country be better and stronger. Mm-hmm. And on the other hand, we really want to focus on building resilience so that people can recover from health emergencies faster.
Right. So I'd like to explore your strategic vision and what frames your direction of your office. Would you highlight your key strategic priorities, and what are some of the key cross-cutting themes that inform your strategic approach?
Well, I would say that the key themes and our overarching goals are, number one, having communities and individuals that are really able to withstand adversity. Having modernized systems with capabilities that are not just on the shelf, but exercised and continually improving. So whether it is the healthcare system being able to move people to what I would call the next lowest level of safe and appropriate care, or a system that can rapidly vaccinate a population or get pills in mouth quickly, a modernized system with those capabilities that we exercise and know we can do if we have to. Making sure that we have the right policies at the national level to allow resilience to grow and develop and spread across the country, and that those policies are jointly developed by those they affect, really all of us. And then building our organization. As I said, our organization is relatively new. It doesn't have the long and impressive history that so many do. And so really building this organization, not quite, but almost from the ground up in terms of developing a staff and a team and leadership team, developing our people for the next generation of leadership, creating a culture, and processes and procedures for doing things.
Right. You've mentioned a couple of times the promotion of a resilient community or a resilient population. It's almost like the vigilance of resilience in a sense. How do you folks do that? What are some of the initiatives you have in place to do that?
Well, we've done that in a lot of really interesting ways. I should preface this by saying that most people judge how bad a disaster is by how quickly they can bounce back, right? And so this concept of resilience and being able to bounce back quickly turns out to be really, really important. So on the one hand, it takes healthier people, and that's why we continue to have this focus on health. And I'll just divert for a moment and share with you that, for example, in a number of previous hurricane events like Rita and Ike, one of the biggest challenges that people had was evacuating people over 300 pounds.
Oh.
Because it's hard, and you need specialized equipment and extra people. And so the resilience of the community and of the healthcare system being able to deal with that is really important. And so we butt up right from the get-go against public health, right? And a strong public health system that deals with the obesity and chronic disease epidemic in our country, terribly, terribly important. But we've taken on some very specific initiatives to deal with resilience and to be sure that it's a driver of the health security programs across government. One that you'll probably be most interested in is one that we've been doing with social media. So we know that people who are connected with one another, who have strong social support, who are friends and relatives they can count on in an emergency, live longer, are healthier, and are more resilient. So one question we had was, well, how could we go about doing this? Well, what is it that most people use day to day? They use social media. And so we said, wouldn't it be a great idea if we could get a Facebook app, for example, where people could identify their lifelines? Of your many Facebook friends, for example, who would you pick out as your lifelines? You can only have 3. But I really want them to be people that you count on when the chips are down. They're not your 5,000 friends, but who's going to get you out of harm's way? Who's going to give you a place to stay? Who's going to help you get back on your feet that you can really count on? So turns out Facebook doesn't write apps, doesn't develop apps. Other people do on a Facebook platform. And so we were actually the first part of the department to use the America Competes Act, the ability to have challenges and competitions.
Wow.
And we put out a national competition for people to develop a Lifeline app. And we got all kinds of really interesting submissions and ultimately awarded 2 contestants for this with Lifeline apps. And they're working on launching those. And the goal, quite honestly, wasn't that those be the end-all and the be-all of Facebook apps, but that we start to try to stimulate the market in a variety of different ways so that at the end of the day, however it is that it happens, people get lifelines, and that idea catches on, and that you have friends or family or people you can really count on when the chips are down. So that's one way. A second way that we've been doing this in a much narrower but very much fragile population are people who are dependent on various medical technologies to stay alive. And usually those medical technologies involve electricity or oxygen or something. And so we've started now a health resilience technology program because, in fact, when the power's out, those people really suffer probably disproportionately. They can't stay at home easily because once the battery's out, that's it.
Yeah.
And they have to pick up with all of their equipment and supplies and go somewhere else, often separated from their support system and caregivers, in order just to stay alive. So we've started a health resilience technology program, really to look at what are the kinds of technologies that would help people be able to stay at home when the power's out and the chips are down in that way, or help them get ancillary power. So we're in the process now of working through the development of signaling devices so that their medical equipment will signal either friends or an operations center or both when they don't have much battery life left, and somebody can come get them a charge or get them batteries and that they can stay at home. So that's another way. One is through social media. One is through technologies. We work a lot on making the healthcare system resilient. So we just saw, for example, in Hurricane Sandy, what happened when nursing homes and hospitals lost power and had to evacuate. Well, what you really want is a system in a community that if one part of it is sick or injured, then another piece of it can pick up the slack. And so we've been supporting the development of what we call healthcare coalitions. So coalitions of all of the different kinds of healthcare entities to work together to support the community through an emergency. So that's another kind of resilience. And additionally, all of the part of our organization that builds the countermeasures, it's called BARDA, or the Biomedical Advanced Research and Development Authority, works on having the countermeasures we need so that we can be resilient in the sense of where there a biological attack or release, we would be able to protect our population because we would have the countermeasures and the medications, and we would be able to get pills in mouth, shots in arms, whatever it takes in a very short amount of time.